And away from that, it's tax after tax as government once again proposes to raid the payslip of salaried Kenyans as it effects a 2.75% deduction for the Social Health Insurance Fund. The draft Social Health Insurance Bill 2023, which establishes the fund that will replace NHIF, states that the 2.75% deduction will be paid by all Kenyan households. The bill, one of the 4 bills that received cabinet approval on Tuesday, will be tabled or presented before Kenyans for public participation starting next week. Chemutai Goin reports.
In what is likely to elicit an uproar from members of the public, the government is yet again set to impose additional taxation measures on Kenyans as it seeks to raise monies that will be channeled towards the achievement of universal health coverage. The Social Health Insurance Bill 2023, which establishes the Social Health Insurance Fund that will take over from the National Hospital Insurance Fund NHIF, has a raft of proposals that will rattle Kenyans. The government is targeting to deduct 2.75% of the gross salary of the over 3 million employed Kenyans to raise monies for the Social Health Insurance Fund. The minimum contribution capped at 300 shillings. There is, however, no capping on the maximum contribution. The government argues that the blanket contribution of 1,700 shillings is unfair and favours higher income earners.
We are changing the funding system so that we can allow the vulnerable to access NHIF free of charge, and those who are in the lower category to pay less, and those who earn more like myself to pay more.
Under the proposed Social Health Insurance Bill 2023, those liable to contribute are every household, a non-Kenyan resident residing in Kenya for a period exceeding 1 year, the national government, the county government, and any other employer. For a household whose income is not derived from employment, there will be an annual contribution matching 2.75% of the household's income that will be determined by a socio-economic assessment that will be carried out by community health workers across the country. Those classified as needy will be covered by the government through a 26 billion shillings kitty.
Na tunabadilisha mambo mengine mengi so that we can make healthcare in Kenya not the privilege of the few who can afford, but the right of every Kenyan who requires affordable and who requires medical care.
Every Kenyan will be required to register as a member of the Social Health Insurance Fund. Other reforms include the Chronic and Critical Illness Emergency Fund, which will be publicly funded. The fund targets complications such as diabetes, hypertension and cancer management and emergency treatment, and is anchored on Article 43 of the Constitution, which states that no person shall be denied emergency medical treatment. The fund covers the cost of management of chronic illnesses in case a patient depletes the social health insurance cover. Another proposed bill geared towards the achievement of universal health coverage is the Primary Healthcare Bill 2023, which establishes a framework for the delivery and access to primary healthcare. Through the bill, 100,000 community health promoters will be hired and will be tasked with being the first point of contact for patients.
We are going to equip our community health promoters with the necessary basic equipment ili waweze kutusaidia kwa mambo ya kutambua magonjwa mapema, ndio tuweze kuyashughulikia mapema, ndio tuwache kutumia pesa nyingi kwa matibabu kwa sababu tumechelewa na ugonjwa.
The bill aims at improving service delivery at the primary health care levels. There is dispensaries and health centers and will be catered for by the government through the exchequer. The bills are set to be tabled in Parliament for members' consideration. Chemutai Goin, Citizen TV.
And a week of